I would like to thank also the coalition for organizing this session. The tasks that have been assigned to, as our president was mentioning, is very broad, talking about the European perspective on vaccines and immunization. And so what I will do is just to hopefully propose a framework that can be of help for building the discussion later on with the other speakers. Prior to start, I'll introduce myself. My name is Odone, and I'm a public health physician. So I care a lot about the public health perspective on health and on immunization, which was mentioned in the previous section. And if we are to talk about immunization, let's just clarify. I don't know how many public health doctors are there in the audience. Only one. I imagine the rest being pediatricians, GPs, microbiologists, nurses. So it's a multidisciplinary approach, thank you very much, to immunization. So it's worth recalling that if we're talking about immunization or vaccination, we're not talking about vaccines. Talking about vaccine is different than talking about immunization or vaccination. Because if we talk about vaccination, we're talking about surveillance of vaccine-preventable diseases and the need for vaccines. We're talking about research and development around vaccines. We're talking about marketing authorizations for vaccines. We're talking about recommendations, and we will see that in Europe, recommendations vary a lot. And then we get to supply and immunization services provided at the local, regional, and national level. And then we're talking about demand, which is a hot topic right now, demand for vaccines, and uptake of vaccines that we measure with coverage. And in this framework, we do have coverage data that measure the impact of policies. So this is the framework around immunization. So we're talking about something which is much broader than just talking about vaccines. And this was the premises. The second perspective is the European perspective. So what do you think Europe is? Of course, we have the flag. We all feel very Europeans. But I think the right metaphor is thinking about Europe as a puzzle made of single pieces which constitutes communities, regions, and countries. And if we are to talk about immunizations, all those differences need to be taken into account, because we will see we have different immunization schedules, not only at the national level, but at the regional level. For example, I'm talking about Italy. And so this has to be taken into account in order to see what Europe can do to promote immunization. What does the EU do for its citizen health? Well, we can discuss about it and focusing in particular on immunization. What does the EU do for promoting vaccination uptake across its regions? So Europe does a lot of things, but we have to start by saying that the health mandate that Europe has on health is quite tiny. Health is responsibility of single member states. I have, just for comprehensiveness, reported on the slides the treaties, the Maastricht Treaties 1992 and the Lisbon Treaty 2007, that tells us that there is tiny Europe can do about influencing and directing health policies at member states level. So the first treaty, Maastricht Treaty, introduced for the first time a public health mandate for the EU, which is important because it's in the treaty, and then stimulated cooperation between member states that need to be supported at the European level. Then the Lisbon Treaty in 2007 reasserts member states' power on public health policies. So health is at the country level, and we are very proud of having health at the country level. But then further develops the scope for a European action on health, and there is where we build up our discussion from. So all in all, there is a limited legal power that the European Commission has on health, but a very broad spectrum for supporting, coordinate, and supplement member states' action. And here I want to focus on this framework, but about, of course, immunization and vaccination. So Immunization policies are under member states' responsibilities. We have said so. And what does bring to the discussion? That we have different health systems varying. In 29 countries, health systems varies a lot with different funding, different mandate, different politics. We have different economies. We have different vaccine-preventable diseases epidemiological partners, and we have different cultures that influence attitudes and behaviors towards vaccine uptake. So this has to be taken into consideration in order to see what the European action on immunization can be and how fruitful can it be. To see the glass half full, this is just the Italian example. We were talking about, because I know I shouldn't talk about Italy, because the mandate was to talk about Europe, but in order to give you an example, Italy, for example, in Italy we do have universal health coverage, so the national level just set the general objectives and the fundamental principles of the national health care systems, and then the regions, we have 21 regions in Italy, then they provide and deliver healthcare services. And how is that reflected into immunization policies? So at the national level, we have the vaccines that are recommended at the national level and that are actively offered free of charge to all citizens. Then the regions are to adopt the national immunization prevention plan and pay and provide immunization services. This is just the Italian case, but I imagine in Spain it's different, in Lithuania it's different, so all this needs to be taken into account if we're talking about immunization at the European level. I was saying, what is the European action on immunization? So there are many things we can do. Just saying that the mandate, the legal mandate is tiny, it doesn't necessarily mean there's nothing Europe can do on immunization. First of all, Europe collects data. Some data are collected in a standardized way, some data are not yet collected in a standardized way. If we're talking about data collection carried out at the European level, we have surveillance of infectious diseases. I'm sure you're all aware of the fact that the ECDC, which is the European Technical Agency for Infectious Diseases Prevention and Control, has now a quite solid system of data collection of infectious diseases, not only vaccine-preventable diseases, surveillance for 56 diseases, and a standardized reporting and data comparability across the EU, which is very good because it allows to make comparison, it allows to measure the impact of specific policies on infectious diseases control, and so this is something that the EU, through its technical agency, does. And of course, there are reporting and overviews of infectious diseases across Europe by country, by year, and by subgroups of the population, with all the difficulties related to heterogeneous systems of data collections across different countries. Other data that are collected are recommendation on immunization. Here, I've just put the example of pneumococcal immunization programs, and from that snapshot you can see that the recommendation varies a lot across countries. And this is something we might want to discuss at a later stage. I mean, why does the recommendations for vaccines that do work, we heard the presentation earlier on, differ so much? That can be due to different epidemiological patterns of infectious diseases, but there are other reasons to be taken into account. So the EU does an effort to collect. If you go on the website of the ECDCs by single vaccine, you can see how the recommendations are distributed across different countries. And there is, I just would like to underline, there is a report on the state of vaccination in Europe issued in last year, in 2018, that tells you all the different recommendations for single immunization program at the European level. And this is an overview of all infant immunizations and their distributions by recommendations across different EU countries. And then we have immunization, and now we will talk about adolescents later on, so this is a snapshot for adults, pregnant women, and older adults. Then the EU collects, not really well, coverage data. Why I'm saying not really well? Because the level of data collection on coverage, the quality of data collection coverage across Europe varies a lot. But the ECDCs provide some general data coming from ministries of health and country members, technical agencies on data coverage. And here we have measles, but I know we will talk about measles later on. Second point, EU provides technical support to member states. So Europe helps member states with recommendations, communications, and training. And here I've put some examples. So the ECDC gives scientific advice on how to collect data, on how to assess the impact of immunization programs, on how to build information and communication technology tools in order to support vaccine delivery at member states and regional level. ECDC does communication and training. Third, I'm going very quickly, this is just to give you an overview of the European action on immunization. Third point we can make is that there is a EU policy action on immunizations. We have said the vaccination policies is competence of national authorities, but the European Commission assists countries in coordinating their policies and programs. For example, there was the recommendations of the Council back in 2014 on the need to strengthen EU cooperation and action on vaccine-preventable diseases control. And that was reinforced, that was the very famous Council conclusion back in December 2014, and that has been recently reinforced by another communication last year, 2019. Commission calls for stronger EU collaboration and cooperation against preventable diseases. So it proposed 3 main pillars for action. Tackling vaccine hesitancies that we will talk about is a burning problem in Europe, improving vaccination coverage, sustainable vaccinations policies across the EU, and EU coordination and contribution to global health. And it outlined, we don't have time to read through them, 20 concrete actions by the Commission and Member States, which includes, as you can see, national and regional vaccination plans, EU data warehouse, European information sharing systems, and so on. So policy. Number 4, a powerful advocacy action that can be carried out at the European level. Some of you, I imagine, attended this very, very big summit that was organized jointly by the European Commission and the World Health Organization back in September this year, that brought together experts, countries, scientific societies, to talk about global vaccination summit just after the World Health Organization has identified vaccine hesitancies as one of the 10 threats to global health at the global level. So strong advocacy power to be carried out at the European level. What else? Are we missing something? We have 4 bullets on the European action, some directly affecting immunization policies, some others indirectly affecting the support of immunization programs. Are we missing something? Research. So the European Commission supports research. There is now a joint action on vaccination, which was launched which started in 2018, jointly carried out by 20 partners in 17 member states and 3 non-EU countries, with a total budget of almost 6 million to be used in the next 3 years to do what? Strengthen scientific evidence for national programs, to improve digital immunization information systems, concept of data warehouse on demand and supply for vaccine at the European level, vaccine research priority setting framework, and vaccine confidence. Now we talk about vaccine confidence, not anymore about vaccine hesitancy to see the glass half full, but this is what we're talking about. And last, but not least, the role of scientific society. Here, I'm just self-promoting the European Public Health Association, which is an umbrella association of public health associations across Europe, counting now on 86 members across the wider European region that has a section on infectious diseases control, which has those missions. And so the role of this, or also other scientific association, can be scaled up to the European level. And I believe that moments of sharing ideas such this one can be a useful example of what can be done at the European level as part of scientific society and the scientific community. So to summarize and to finish with a note of enthusiasm, I would say somebody said that Europe, despite being a huge bureaucratic body, it also a natural laboratory with very large variations in cell systems and difference, and we said so, but also a huge opportunity to learn from experience from elsewhere and share best practice. And this is why we're all here, I think, today. And with this said, I thank you very much for your attention. I leave the floor to my colleagues. Thank you very much.
Thank you very much, Anna.